Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for this week. I'm honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We'll have our written report for the weekend case numbers, hospitalization, other critical information. It will be with you before 3 o'clock today. And in addition, the surgery numbers, which typically we do on Tuesday, will be provided later in the week, the number of surgeries canceled. So you'll expect that later in the week, and those other numbers will come in our written report before 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today I'd like to provide the latest update on our ongoing COVID-19 public health response. For many months now, as I don't need to say, I think, as COVID-19 continues to circulate in our communities, I've been asking everyone to take steps to protect yourself and those around you. And those steps remain as relevant and as important as ever. As we learn more about this virus, we have adapted our approach, and with us, step by step, have been millions of people in British Columbia. We've seen now how interconnected we all are, that the choices we make affect not only our own health and well-being, but it affects the health and well-being of our communities, our families, and our province. And we're seeing that with the challenges that are faced in different parts of our province. The actions we take or choose not to take affect the children in our lives, affect our elders and seniors, our neighbors, our friends. And we know the numbers over this past weekend have been stable, but they are still very high. And that means that we've had, again, increasing impact on our hospitals and our critical care. With this in mind, I'd like to address the situation we are currently facing in BC's north. We have been closely monitoring the situation in the north, and my public health colleagues and I are very concerned with what we continue to see in many communities across the north. COVID-19 is spreading at a higher than average rate. People are becoming severely ill, even young people, mostly unvaccinated younger people, and hospitals are pushed to the limit across the north. This is directly related to the vaccination rates in the communities where people are living. Communities with lower rates of immunization have higher rates of spread. The illness and the risk for everybody goes up. To address this, we have already put in regional health orders and are actively working with the Northern Health, my colleagues, to determine what additional measures we may need to break the chains of transmission across many communities in the north. For everyone, and especially people in the northern BC communities, we need to get back to the basics, the things that we know prevent transmission of this virus that we transmit to the people we are closest to, our family, our friends, our loved ones, our communities. We need to determine if there's additional measures that we need to take as well, and we need to ensure we're using all of the layers of protection we have available. That means washing your hands regularly, staying home when you're unwell, wearing your mask, particularly when you're around other people who are more vulnerable and in indoor public spaces, keeping a safe distance from others, and also getting vaccinated. It is not too late to make a difference for your own health and to protect your healthcare system and your community. We are also looking at whether we need to use booster doses in certain communities as a way to manage some of the severe illness and the outbreaks that we are seeing. We know that private gatherings, ceremonies, funerals, and celebrations are a source of transmission, and it's transmission not just within a community, but people going from community to community. So I also want to remind the organizers of these types of gatherings and faith leaders in particular to ensure that you are using the guidelines that we have in place to protect your congregations, that you're ensuring everybody wears a mask in the indoor spaces, that you are carefully considering how or if people are coming together with high risk in communities right now, and making sure that you can provide those virtual and online options that support people, particularly people who are more susceptible to severe illness or death from COVID-19. During this time of high risk, we need to go back to those basics, those things that helped prevent transmission in our communities. And what I'm asking people to do is not new, but we know it works. And those communities that are impacted now, we are seeing the effects of the stress on our healthcare system in the north, and that means people being transferred for critical care, and we know how stressful that is on families to not be able to be with their loved one when they're in serious condition. My healthcare colleagues across this province are also stretched, and we are tired. It's been a long 20 months, and I don't need to say that to people in British Columbia. It is so hard for us to see a preventable illness now affecting people across the province. And that is because we need to get vaccination rates up to protect people from having severe illness. A number of things that we are doing right now. Today, the provincial health order, the provincial health officer order requiring COVID-19 immunization for all those working in long-term care and assisted living has come into effect. And a similar order will be in place for acute care and community care that will come into effect later this month, and that order will be posted later today. Together, these orders apply to healthcare workers in all settings and all workers in healthcare settings. It is very broad for the very reasons that we know that these are settings where transmission causes strain on the system if healthcare workers are infected, but also can mean transmission to those who are most vulnerable to severe illness. I want to thank all of the healthcare workers who, for your own reasons, may have delayed getting your vaccine, but have now taken this important step. It is not too late. Few know better than those working in long-term care and assisted living what the impact of COVID-19 has been on our seniors and elders, particularly those who live in long-term care. As our seniors advocate has highlighted, it is these people who have suffered the most, both from COVID itself, but also from the measures that we've had in place to try and protect people. And I am incredibly grateful that you are doing all you can to support them and keep them as safe as possible as we weather this next phase of the storm. It is also important to know that this is a measure that protects you as a healthcare worker and keeps you able to care for those who are more vulnerable. It protects our healthcare system, our families, and our communities. I recognize as well that our public health mandates have changed over time, and they will continue to do so as the pandemic evolves and changes. And just as we may increase or decrease public health measures to ensure our protections are in step with our risks, we also want to keep things as straightforward and as simple as possible. So recognizing that young people are now wearing masks from K to 12 in our school system, I'm adjusting our public mask mandate and requiring it for everyone 5 years of age and older to wear a mask in all indoor public spaces. And that will be posted in the updated order today. For youth, whether taking the school bus or the city bus, the rules are the same. And I just want to say how impressed I am. I continue to be amazed at the adaptability and the resilience of children across this province, and many of them have told me that that they know how to wear a mask now, and that it's something that they do to keep themselves safe, to keep their families safe, and I just want to say thank you. We are also, as you may have heard, readying our province to be able to provide COVID-19 vaccines to youth 5 to 11 years of age as soon as the vaccines are approved for use by Health Canada. And we have heard that at least the preliminary data package has been submitted to Health Canada, and we may have that important vaccine available to us as early November. So we continue to talk with school communities, families, and parents to ensure the process will be as seamless as possible for everyone and make sure that our logistics are all in place so that we can provide this vaccine as soon as it's available. In the meantime, parents can now pre-register your children in the same way that we have registered ourselves or older children over the past year and a half. Notification of eligibility to book an appointment will be provided as soon as these vaccines are approved for use by Health Canada, and we have a sense of when they're going to be available to us in the province. So we are continuing to do what we need to do to make sure we can roll out that program to protect younger children as soon as the vaccines are approved. I'm also very pleased to see more and more businesses across BC and across the country are bringing in vaccine requirements in their workplaces. And we know that this is something that will protect employees, will keep workplaces safe, and keep businesses functioning safely. So I encourage everyone to take this important step as well. The COVID-19 pandemic has evolved, and so have we. And we need to continue to evolve to deal with each new twist we are faced with. We will continue to be nimble in our approach and adjusting as needed as we continue to weather this storm together. Things have changed and will continue to change, and as many people may have heard, the U.S. has recently announced some changes to their upcoming requirements for travel to the U.S., and they have recognized AstraZeneca, which is an important step for I know many people in this province who received that really important vaccine. I know they are also continuing to look at mix and match vaccines, as many countries around the world, the UK, France, Italy, ourselves, have used these important combinations. And the data that we presented here from BC and from across Canada shows how effective the mix and match combinations are. And I know our colleagues in the U.S. Centers for Disease Control are looking at those data as well, and we expect to hear more about this important issue, which I know affects a number of people in British Columbia as well in the near future. I also want to make sure that you know that we are also looking at whether third doses or booster doses are needed for populations in British Columbia. As you know, we've provided a third dose to complete the series for people who are immune compromised, as well as starting a booster dose for residents of long-term care. We are looking at other populations, and we'll be gathering that data and looking at how we might roll those out in the future. I want to assure everybody that we have enough vaccine for everyone, whether it's for someone in long-term care, for a first dose for children, or if and when a booster dose will be needed. As I've said before, we will weather this storm by all of us continuing to do our part and supporting each other along the way. And I think right now, after this weekend, it is particularly important for us to thank healthcare workers across this province. It has been a long, hard road, and we know that you are showing up every day and caring for people across the province who need the services that we have in our healthcare system. And I want to add my gratitude and thanks to our healthcare workers. We need to continue to do our part by following all of our layers of protection. We need to do this with resolve and determination, as we have been through this last 20 months, as well as our commitment to each other to get through this by being kind to each other, being calm and being safe, and getting vaccinated. Thank you.
Thank you very much, Dr. Henry. I wanted to start today by speaking about the situation in the Northern Health Authority. And just to put it in context, over the course of the pandemic, different areas of the province have been affected by COVID-19 differently, and we have all supported one another. We've all been all in to support one another throughout the pandemic, and that continues to be the case. The situation in Northern Health Authority is extremely serious at the moment. I just want to lay it out with one set of facts. We have now transferred critical care patients. 55 critical care patients have been transferred from Northern Health to hospitals on Vancouver Island, in the Fraser Health Authority, and Vancouver Coastal Health. Of those 55, 43 are positive for COVID-19. 42 are not fully vaccinated. 42 not fully vaccinated people transferred in critical care. Over the Thanksgiving weekend, yesterday, Monday, Thanksgiving Monday, 4 people were transferred from Northern Health to either Vancouver Island or Metro Vancouver. On Sunday, 1, on Saturday, 5, on Friday, 4. That's 14 people transferred. I want to put in context these numbers in terms of the critical care beds that are in place for everyone in Northern Health, that usually, in fact, more than satisfy demand. They're in ordinary circumstances, pre-pandemic circumstances for critical care, although there are many challenges everywhere in our healthcare system. That is regularly the case. We have 40 critical care base beds in all of northern British Columbia. There are 42 patients with COVID-19 from the north in critical care, not just sick enough to be in hospital, but in critical care today, in hospitals in the south. There are 23 further surge beds that have been added to our critical care capacity in the north. That makes 63. We have patients in those beds, in the base beds today, and obviously the pressure of hospitalization in all our hospitals, particularly in UHMBC, where our staff of doctors and nurses and health sciences professionals and healthcare workers are doing simply epic work to support people dealing in particular with COVID-19. This is where we find ourselves today. 55 patients transferred over the weekend, over this Thanksgiving weekend. 14 patients flown from communities in the north, hundreds and hundreds of kilometers. It's about 800-900 kilometers by air as the crow flies from Dawson Creek to Victoria, for example. Transferred this weekend. That's how they dealt with their Thanksgiving weekend. And I want to assure everyone in the north, we are all in to support them. On contact tracing, on support for healthcare workers, 55 transfers. We added 2 planes that we have worked with the private sector to add to our BCHS fleet over the weekend. We are all in to support them. But the people I want to speak to today are people who today are walking in communities in the north. Because the people in critical care right now, we're just going to provide them with the best care in the world and support their families and do whatever it takes to help them and help them get well from this vicious, nasty virus. But for those people walking around unvaccinated, who might be in those critical care beds in 2 or 3 weeks, I say to them, now is the time, surely. Now is the time to get vaccinated. With the whole healthcare system all in support, now is the time to get vaccinated. And I'm going to read off some of the clinics, some of the locations of the clinics across the north. And this is true, by the way, of everyone in BC who's unvaccinated and needs to get vaccinated right now. At the Lake Districts Hospital in Burns Lake, at the Chetwynd Primary Care Center, the Tamsi Friendship Center, at the Chetwynd and District Rec Center. There are different immunization clinics coming up. At the Dawson Creek Health Unit, at the Stikeen Health Unit Center for the Dease Lake area, at the Fort Nelson Health Unit, the Fort St. James Health Center, the Fort St. John Health Unit, the Northern Lights College campus. There'll be vaccination clinics at Old Fort Road. In Fraser Lake, at the Fraser Lake Community Health Center. In Grand Isle, the Grand Isle Health Center. At Rinch Memorial Hospital in the Hazelton area. At Coast Mountain College in Houston. At the Hudson Hope Health Center. At the Kitimat General Hospital Multipurpose Room. At the Mackenzie District Hospital. In Massetton area at the Howard Phillips Hall. In McBride area at the McBride Health Center. In Prince Georgian area at the Cariosicani Family Services and the CN Center and the Prince George Conference Center. In Prince Rupert, the Core Space, the Charles Hayes Secondary School, Prince Rupert Community Health Center, in Quesnel at the Quesnel Senior Center, in Smitherson area at Coast Mountain College Smithers Campus at the Healthy Living Center, in Southside area at the Southside Health Wellness, in Stewart at the Stewart Health Center, in Terrace at Coast Mountain College at the Terrace Health Center, in Tumbler Ridge at the Tumbler Ridge Medical Clinic, in Valemont at the Valemont Health Center, in Vanderhoof at the Vanderhoof Health Unit, in the village on Haida Gwaii, the Haida Gwaii Hospital and Health Center. I just want to say to everybody that we need to come together now and raise vaccination levels. You know, and I know, the vaccination levels are high across BC. 88.8% in our province, across our province, 82.6% fully vaccinated of all those over 12, which is impressive by any standard, but we simply need it to be higher. And I'm asking everybody to be part of this effort, to continue to be part of this effort, and to continue to support this effort. As Dr. Henry has said, the requirement for mandatory vaccination in long-term care and in assisted living comes into place today. And I just want to take you through some of the numbers with respect to that so that you have a sense of where we are and the preparations that have been made for this important and significant milestone, not just for workers, but to keep our long-term care homes safe. There are 546 long-term care and assisted living homes covered by the order. We have the data for 542. We're working with the other 4 care homes that we have. This reflects the data in 542 out of 546 care homes. We have 48,879 staff reporting in total in assisted living and long-term care, and the number of people who received their first dose is 46,924, or 96%. The total who received second dose is 45,457, or 93%. The total remaining is 1,955. In assisted living, vaccination rates are slightly higher. It's 97% overall, 94% second dose. And so of the 7,789 staff reporting in assisted living, 7,555 have received their first dose, 7,322 their second dose, there are 234 remaining. In terms of long-term care across BC, there are 43,304 staff reported, 41,572 have received their first dose, 40,273 their second dose. That leaves 1,732 in long-term care. So 1,732 in long-term care, 234 in assisted living. I think that we would say that what that tells us is that we've seen from the time when Dr. Henry put the order into effect to present a significant increase in vaccination rates in long-term care homes, which were over 90% at the time, just over 90%, and are now over 96% across long-term care and assisted living. And we're going to continue to work with health authorities and care operators to make sure that all workers continue to have the support they need to get vaccinated. As a result of the change coming into effect, residents in the vast majority of care homes will have the same care as they do today, with the added confidence that everyone working in their care home is vaccinated against COVID-19. The province is working with health authorities and operators on a home-by-home basis to ensure that if workers do not make the decision to get vaccinated, contingency plans are in place to ensure residents continue to get the care they need. A lot of work has gone into this. Now, obviously, a significant portion of the remaining people who are not yet vaccinated or unvaccinated in the systems, a significant number of those are casuals and not scheduled to work these weeks, but adjustments have been made accordingly. If a long-term care or assisted living worker refuses to be vaccinated, they will be in breach of the Provincial Health Officer's Residential Care Preventative Measures Order, the Public Health Act, and employer policy. They will be subject to progressive discipline up to and including termination. The message remains: get vaccinated, protect yourself, protect your colleagues, and protect vulnerable seniors in long-term care. Long-term care workers who have received their first dose can, in certain circumstances, work pending full vaccination as long as they get their second dose within 35 days of their first dose and remain eligible to work. Additional measures, such as using PPE and rapid testing, will remain a requirement until they are fully vaccinated. With respect to contact tracing, I just want to report as to where we are. Since my last report, health authorities have hired an additional 43 individuals to support contact tracing, bringing it to 1,439 the number of contact tracers in place across the 5 regional health authorities and the Provincial Health Services Authority as of October 8th. That's 504 in Fraser Health, 198 in Interior Health, 159 in Northern Health, 198 in Vancouver Coastal Health, 129 in Vancouver Island Health, and 251 in the PHSA. There are plans to add dozens more across the province, and I'll continue to provide another update this week. In conclusion, I just want to thank, after this weekend of Thanksgiving in our province, all those healthcare workers who are working in the communities, our exceptional staff, and teams of paramedics and dispatchers, people who are in the air and on the ground in BC Emergency Health Services, our healthcare workers, our health sciences professionals, our nurses, our doctors, our folks in the community who are continuing to deal with two public health emergencies with courage and the dedication that we have come to expect from them. The fact that we've come to expect this doesn't make us any less grateful, it makes us more grateful. I want to express my gratitude to all of them.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.